Here the objective to define what is hemolytic disease of newborn, to list the types of this HDN, symptom and causes, and the prevention of rhesus hemolytic disease of the newborn. It's also known as erythroblastosis fetalis. HDN is the destruction of RBCs of the fetus and neonate by antibody produced by the mother, stimulated to form antibody by previous pregnancy or transfusion. 95% cases caused by rhesus antibody and happen in vivo. In vivo hemolysis dalam badan. Okay, first the type of HDN is ABO system. ABO hemolytic disease of the newborn can range from mild to severe, but generally it is a mild disease. Two antibodies that involved in causing ABO HDN are anti-A antibodies, anti-B antibodies. Maksudnya antibody towards A dengan towards B. Okay, woman of the blood type O, the third sensitization model can occur in woman type O. The immune response to A and B antigen that are widespread in the environment usually leads to the production of IgM, antibody A, and IgM of antibody B. On rare IgG antibodies are produced, the production of this IgG antibody may trigger the HDN. HDN can also be caused by an incompatibility ABO blood group. It arises when a mother with the blood type O becomes pregnant with a fetus with different blood type, AB ataupun AB lah. Mungkin husband ni lah, yang lain darah selain pada O. Okay. The mother serum contains naturally occurring anti-A and anti-B. Sebab dia darah O, dia darah O, dia ada antibody A dengan antibody B, which tend to be of the IgG class and can therefore cross the placenta and hemolyze the fetal RBC. Kenapa IgG ni boleh cross the placenta? Sebab dia, kalau untuk immunoglobulin, dia, size dia dibentuk Y tu. Single unit sahaja. IgG Kalau IgM dia pentamer. So dia adalah IgG combine together dia besar. So dia besar dia tak dapat nak cross the placenta. IgG dia boleh cross the placenta. Usually less severe than this. Okay. Sama juga. Antibody A and antibody B of the IgG will cross the placenta to coat infant cells, which may result post direct home. Direct home test lah. Direct home test is positive. Okay, now we move to the next HDN is rhesus system. Okay, rhesus D hemolytic disease of the newborn, often called as rhesus disease, is the most common form of severe HDN. The disease varies from to severe. Rhesus E hemolytic disease of the newborn is a mild condition. Rhesus C, small c of the HDN, can range from mild to severe. Rhesus small e HDN is rare. Rhesus C is also rare. The antibody combination, kalau semua ni adalah dia sekali ni, it can be severe. Okay, next is Kell system HDN. Kell yang tadi anti-K. Anti-K antibodies, this range from mild to severe. Over half of the cases caused by multiple blood transfusion. This is the second most common form of severe HDN. Okay, pathogenesis occurs when mother IgG attached to specific antigen of the fetal RBCs. AB, the antibody coated cells removed by macrophage. Destruction of RBC and will cause anemia, low of RBC lah anemia. Anemia will stimulate marrow to produce more RBC even in immature cells. Okay, bila anemia, bone marrow is forced to produce more new RBC. Okay, the spleen and liver enlarged due to portal hypertension and hepatocellular damage. The RBC destruction release hemoglobin and will metabolize to indirect bilirubin. This indirect bilirubin will transport across the placenta and conjugated in the maternal liver. Conjugated bilirubin then excreted by the mother. After birth, accumulation of unconjugated bilirubin becomes a severe problem. Newborn liver will unable to conjugate the bilirubin efficiently. Okay, unconjugated bilirubin as a toxic to infant's brain, characteristics, and brain damage. The research at the end, research positive of the firstborn infants, while mother research negative is unaffected. Ini kalau firstborn baby research positif, kalau mother negatif, tak ada apa-apa efek lah. Okay, but while during the delivery, variable numbers of fetal RBCs enter the maternal circulation and stimulate the antibody D. Masa beranak kan bertumpah darah kan. There's a mix up of the blood from the baby and mother. Sebab mother dia adalah negative for the NTD, but the baby is positive, so mother's body akan produce antibody towards the rhesus. Rhesus positive. Okay. The effect will be subsequent to will affect to the subsequent offspring. If the baby also a rhesus positive, the NTD that been stimulated in the mother's body, dia akan cross the placenta and bind to the fetal rhesus positive and destroy the RBC of the baby. Other antigen in the system like T and E, also potent immunogens. NTE can cause HDN severe enough to require treatment. Okay, ini baby, ini the mother. So if the baby is a rhesus positive, for the first newborn is okay. Second newborn, if the baby is rhesus positive, the antibody from the mother, antibody D, akan cross, which is the IgG form, akan cross the placenta and attack the baby. Okay, the causes of HDN. In HDN, the fetus inherits a blood group antigen from father that is foreign to the mother. If the mother is exposed to an foreign antigen and produce IgG, the IgG will target the antigens and may affect it in utero and persist after delivery. The three most common models in which a woman becomes sensitized toward a particular blood type are fetal maternal hemorrhage, receiving therapeutic blood transfusion, woman of group O. Okay. Fetal maternal hemorrhage. The fetal maternal hemorrhage can occur due to a trauma, abortion, childbirth, ruptures in the placenta during pregnancy. Medical procedures carried out during pregnancy that breach the uterine wall. In subsequent pregnancies, if there is cellular incompatibility in the fetus, these antibodies are then able to cross the placenta into the fetal bloodstream to attach the red blood cells and cause hemolysis. Sama macam tadi Second born and onward, dia ada problem lah. In other words, if a mother has an NTD, IgG antibody as a result of pre-carrying a rhesus positive fetus, this antibody will only affect a fetus with rhesus D positive blood. Rhesus D negative baby will not be affected by this antibody. Rhesus negative baby tak ada apalah. Yang positive je problem. Receiving incompatible blood type, a woman may receive a therapeutic blood transfusion with an incompatible blood type. ABO blood group system and rhesus blood group system typing are routine prior to fusion. Suggestion have been made that a woman of childbearing age or young girls should not be given a transfusion with Rh positive blood or L positive. Exposure to this particular blood group will trigger production of NTC and NTK, which may cause severe HDN. Rhesus immune globulin. It is administered to the mother within 72 hours following delivery to prevent active immunization of the rhesus D antigen on fetal RBC. Maksud dia, before the delivery, patient tu hospital dah identified lah dia ada possibility to develop NTD. Sama ada tu rhesus negatif lah. So, rhesus immunoglobulin ni akan inject to the mother to pre-active immunization of rhesus D. Rhesus D attached to the fetal rhesus positive RBC in maternal circulation, blocking immunization and production of NTD. Okay, how the diagnosis? Diagnosis by using the serology, ABO and screening for antigen, antibody screening by using 2 or 3 screening cells, antibody addition if they are screening positive. Aminocyte testing can be done as early as 10 to 12 weeks gestation and use the antibody titers to check the concentration of the antibody. If antibody screening positive, proceed with the antibody identification, probability rhesus negative with NTD ataupun rhesus positif, NTE ataupun NTK. Titration and monitor level first and trimester every month, third trimester every 2 weeks, rate of increase in titer and order of baby. Okay, that's the antenatal testing. ABO and rhesus screening is a part of the routine lab testing, antibody screening for irregular IgG antibody. Antibody identification is proceed if the screening is positive. Antibody titration is significant antibody is identified to identify any strength of the antibody. Paternal rhesus typing is the blood of the father can be tested to determine whether he carries the corresponding antigen. Amniocentesis to measure fetal bilirubin to confirm rhesus disease. Obstetric ultrasonography is a non-invasive procedure, routine scan performed by specialists to detect hydroxyphilics. Doppler is an ultrasound to determine the degree of anemia by measuring the speed of blood flow in the fetal vessels. Cardosynthesis is a percutaneous umbilical cord sampling to determine the hemoglobin, bilirubin, blood group, and direct antiglobulin testing. ABO and rhesus group perform on mother and neonate. Direct antiglobulin testing on neonate. For DAT sensitized in vivo, rhesus has DAT strongly positive. ABO has DAT weak positive. Rhesus typing, if the significant antibody to an antigen other than the rhesus of neonate should be phenotype. Maternal rhesus cell antibody reaction, identification and titration. Paternal sample should be tested for irregular red cell antibody. Neonate hemoglobin estimate to indicate the severity of anemia. Neonate bilirubin should be estimated to indicate the severity of jaundice. Okay, this is the result finding. Okay, the sign and system or clinical presentation: asphyxia, pulmonary hypertension, pallor, edema, respiratory distress coagulopathies, jaundice kernicterus, and hypoglycemia. Okay, ni biasa berlaku lah kalau transfusion reaction. Sama. Okay, selection of the blood for transfusion. Select blood that does not have antigen which the mother has developed the antibody. If the antibody is due to rhesus D and transfuse rhesus positive baby with rhesus negative blood. Use mechanism for compatibility testing. When compatible, whole blood for replacement transfusion is not available. If ABO compatible mother, blood with PEXA. Okay, selection of blood for essence transfusion. Kalau mak dia darah O, baby berdarah O boleh pakai O lah untuk transfusion for the baby. Kalau baby darah A, mak darah O, kita pakai emergency O. Okay, ni how the intrauterine transfusion melalui the umbilical cord. Okay, if there is strong clinical, lab and histological evidence of severe hemolytic disease, it is felt fetus may not survive to the earliest time. The aim is to provide a grossly anemia fetus with sufficient donor cells for survival and premature delivery. Using ultrasound and introduce donor cells via the umbilical vein. For the blood cell, freshly bled, high viable of red cell, antigen negative, respect to specificity of the maternal antibody, filtered the blood to remove the WBC, the white blood cell of the donor cell, irradiated to inactivate lymphocytes. Meaning that the blood transfused is very possible as damage to the baby.